My name is Terry King. I'm the Chief of the Division of Breast Surgery at Brigham and Women's Hospital and Dana-Farber Cancer Center. I'm also the Associate Chair for Multidisciplinary Oncology in the Department of Surgery, and I am the Director of the BPREP program. BPREP is our high-risk program for women who are concerned about their risk of developing breast cancer. Breast surgery is, in general, very safe surgery. Most of our procedures can be done under limited anesthesia, either what we call monitored anesthesia or short courses of general anesthesia. When patients undergo lumpectomies, sentinel lymph node biopsies, and even axillary lymph node dissections, these procedures are typically performed as outpatient surgery, not requiring an overnight stay in the hospital. The most common complications after breast surgery are bleeding in the postoperative period, requiring return to the operating room, and infection. Both of these complications, however, are quite rare. Bleeding requiring returning to the operating room happens in about 1 or 2 out of every 100 operations that we do, and infections requiring antibiotics occur in about 5 out of every 100 operations that we do. Certainly larger operations such as mastectomy or mastectomy with reconstruction, these operations are associated with slightly higher risks of complications, but still are very safe surgeries. The type of reconstruction procedure that is performed has a significant impact on the type of complications that can occur. So of course, bleeding and infection can occur with any type of breast surgery or with any type of breast reconstruction. But in women who are undergoing what we call autologous tissue-based reconstruction, that means actually moving a free flap of tissue from another part of the body into the breast skin to recreate the breast. These procedures often involve what we call a microvascular anastomosis, so actually sewing 2 blood vessels together. Therefore, these procedures are associated with different risks of complications than your standard breast cancer surgery that does not involve vascular reconstruction procedures. Again, breast cancer surgeries are very safe surgeries, but certainly the more surgery that we do, the higher the risk of complication. So for example, in women who undergo bilateral mastectomy, the risk of complication is twice that of women that undergo unilateral or one-sided mastectomy. We often have patients asking us about removing the contralateral breast or the other breast when they're faced with the diagnosis of new breast cancer in one breast. We certainly know that there are some women who have a significant risk of that contralateral breast cancer or the other breast developing breast cancer, but most women actually have quite low risk of developing contralateral breast cancer. So it's important when we're discussing these procedures with patients, again, although breast cancer surgery is safe, doing bilateral breast cancer surgery when it's not medically necessary has to be countered by the fact that it does increase the risk of complications. Now, of course, there are risk factors that patients may have that might put them at higher risk than someone else. Of course, these risk factors are common across all surgical procedures. So we know that women who are active smokers, women who have poorly controlled diabetes, and women who are very obese, these women are going to have a higher risk of having a complication, even a simple complication such as an infection. And we need to counsel them to be sure that they understand that if there is anything that we can do to optimize their surgical outcomes, such as potentially helping them to quit smoking or getting their blood glucose under better control before the procedure, that these interventions will in fact lower their risk of having a complication. So again, in general, breast cancer surgery is very safe surgery, and we certainly don't want people to avoid having their breast cancer treated, but we do want to be aware of the factors that can increase risk of complications, and we want to avoid unnecessary surgeries.